I just wanted to pick up something that Ms. Puri said of CPCB that I think is very important to emphasize, and that is that many of the guidelines that have been put out and that we've been using for a long time now work. They work with COVID, and so the important thing is just making sure we follow those guidelines rigorously. And so what CPCB did is just add a few more additional things because of the nature of this pandemic. But I wanted to start with the science to explain why doing what we've been doing for a long time works. So let me begin by just putting this virus into context. First of all, it's important to note what are the ways in which the virus can be transmitted. And the main way is through respiratory transmission, and it's primarily what is accepted by everybody is it can be transmitted through droplets. These are larger size particles. But then there's some debate. I'm in agreement with many of those who say that we need to look at the high likelihood of aerosol transmission, meaning it can also be transmitted through the very tiny droplets, 5 microns and smaller, that spread and don't fall into the ground. The concept of respiratory droplet means that typically within 1 or 2 meters or so, these large droplets would fall to the ground. That's the basis for our physical distancing. But with airborne transmission, it means that there's a possibility it could spread to even longer distances. And that's the reason why masks are very important. The second way to be transmitted is also through contact with contaminated surfaces. You touch something that has the virus, then you touch the membranes of your nose, mouth, or ears, or eyes. And that's the reason why hand hygiene is also very important. So these are the 2 main ways. But let me also put the whole COVID virus in context. So if you compare it with many other diseases, we know that COVID is more contagious than Ebola, but it is much less contagious than other diseases that we already are quite familiar with. For example, polio, mumps, whooping cough, diphtheria, and so on. It's far, far less contagious than measles. Measles is much more contagious than COVID-19. And in terms of its lethality, COVID-19 is more deadly than seasonal flu, we know that, but it is less deadly than the Middle East respiratory syndrome disease, than avian flu, H5N1. It's less deadly than Ebola or even untreated tetanus or rabies. So just to put things into context, the reason for this is that many people tend to panic not knowing something that's new. And so we end up doing far more than we need to do, and in some cases, making the situation worse. So another thing that's important, something very basic, is how long does this virus remain in the environment? Well, to answer that question, we need to know what is the temperature, what is the humidity, the relative humidity, and we also need to know what is the material on which the virus is on, and then that will tell us how long it's going to last. So for example, on tissue paper at 22 degrees, so maybe in an air-conditioned room, for example, at 65 degrees relative humidity, it would last for about 3 hours. In copper, which we know has antiviral properties, it would last for about 8 hours. In the aerosol, just floating in the air, it would last for about 11 hours. And you can read the rest. For some, it would take a few days, like cloth, it would stay for about 2 days. Where it stays longest would be in very smooth surfaces, especially stainless steel and probably other metals and plastics. It stays in plastics for as long as 7 days. But by the way, I should also point out that it doesn't stay at the same amount. What happens is maybe for the first day or so, it drops down and then small amounts remain there until the very last virus, the remnant that's still infectious might just be a little bit of it left, say within 7 days would completely no longer be infectious. So that's the basis, by the way, for what CPCB said, that sometimes for certain types of waste, you could just leave it out, don't touch it, and after a few days, we're fairly confident for many of those cases, the virus is gone, no longer infectious. Now, when it comes to medical waste, here's another very important thing to keep in mind, and that is the virus that's responsible for COVID, which is COVID-2, is among the easiest pathogens to destroy. So let me explain that using this table, which is perhaps well known for many people working in infection control. What it does is it shows you how resistant certain pathogens are to being destroyed. So for example, one of the pathogen that's most difficult to destroy is a pathogen I had worked with years ago, and these are called the prions. And so this is the protein particle that causes things like mad cow disease and so on. So these are very difficult to destroy. They even can escape incineration. The next in that list are the bacterial spores. For example, I give the example of Geobacillus staphylococcus or Bacillus atrophius, which used to be called Bacillus subtilis. And these spores are also difficult to destroy. Anthrax is another example. And then next to that would be coccidia, then the microbacteria that cause things like tuberculosis and so on. And then as you go down that list, it becomes easier and easier. The non-lipid viruses such as polio or hepatitis A are easier to destroy than microbacteria, but they're more difficult to destroy than, say, fungi or vegetative bacteria. Vegetative bacteria, the ones we're familiar with, staph, strep, pseudomonas, etc., E. coli. But the easiest to destroy of all is what's at the very bottom. These are the lipid viruses, viruses that have a lipid envelope around them. So HIV is easy to destroy, hepatitis B is easy to destroy, influenza, Ebola, and in this list are all the coronaviruses, which includes, of course, the COVID-19 virus. Very easy to destroy. So this is a small list of the main disinfectants that can destroy the coronavirus. So for example, in the case of, say, the bacterial spores, what you see here will not be sufficient to destroy it. But for coronavirus, this is more than enough. So we can use 1 to 2% bleach and it will destroy the coronavirus within 5 minutes. We know that alcohol and whether it's ethyl alcohol or isopropyl alcohol will destroy it in a matter of minutes. Same with peroxide and so on. So that's the reason why we ask people to do hand hygiene, to use sanitizers, and these are also the chemical disinfectants we use for the waste. Now, surprisingly, although it's often not listed as a chemical disinfectant, one of the most effective ways of killing the virus is simply soap. And the reason has to do with the fact that this is an envelope virus. If you look at the chemical structure of soaps, that's the picture on the left side. A typical soap would have a head that's considered hydrophilic. It loves water, and it has a long tail, and that tail doesn't like water, but it likes lipids. And an example of a lipid is the coating around the virus. And so what happens then is that when you wash your hand, or even if you just soak something that has virus in it, the COVID virus, in soapy water, what's going to happen is that the tail of the soap is going to break through that envelope of the COVID virus, and when it breaks it open, it's going to release the RNA and other viral remnants. And then there's another property of soap, and that's called mycel creation. It creates a mycel which traps the virus, and by doing so, it renders the virus no longer infectious. So the study that I mentioned in the previous slide with the reference shown at the bottom, this study said that by simply soaking a sample which contained a lot of virus, they tested this on very high titer virus, in soap, 2%, simply 2% soap and water solution. In 5 minutes, there was very little virus left. In 10 minutes, there was no virus left that they could measure, that they could detect at all. So this is the reason why washing our hands with soap and water is a very important practice to have in terms of protecting ourselves and stopping the spread of the virus. So now in general, the virus is also easy to destroy with hot temperatures. So for example, just for comparison, on a cool day or in an air-conditioned room, the virus might survive for as long as 2 weeks. I shouldn't say survive, it would be infectious for about 2 weeks. And in some case, when it gets warmer, like on a hot day, 37 degrees, it will only exist, this is based on laboratory studies, it'll only be infectious for about, within 2 days, it'll be destroyed, it'll be inactivated. However, if you put the virus or put something that's contaminated with COVID in hot water, if the water is at about 56 degrees, the virus will be inactivated within 30 minutes. To give you an idea what 56 degrees is, 56 degrees is recommended by people who are connoisseurs of tea, and I know there are a lot of people in India who love teas, as I do. 56 degrees is supposed to be the temperature at which you're supposed to serve tea to your guests with brewing. So that gives you an idea of what temperature that is that inactivates the virus within 30 minutes. If you increase it to 70 degrees, it will inactivate it within 5 minutes. Notice 70 degrees is not even boiling. Boiling is at 100 degrees. So you don't even have to get the water to boiling. And boiling would probably be inactivated in seconds. But at 70 degrees, it just becomes inactivated in 5 minutes. So the CPCB has approved a number of technologies, and these are technologies approved around the world for medical waste, especially for, say, red bag waste. And so these technologies like gravity-fed autoclaves, vacuum autoclaves, these are technologies that operate at 121 degrees, 185 degrees, and so on. And so if the virus is inactivated within 5 minutes in only 70 degrees, how much more in 121 degrees for 60 minutes, or for at say 135 degrees in 30 minutes. So in a way, the technologies that we have approved and have been using for decades now are more than enough to destroy the COVID-19 virus. That is an important message. We can continue what we've been doing all these years because they're all more than enough to sterilize, basically to destroy the COVID virus. The important thing is what I mentioned at the bottom. We just need to test the equipment at whatever is the required time, like every 30 days or whatever it might be, to validate using, notice what we use to test the equipment is the bacterial spores. We want to make sure that it kills the bacterial spores by what we call a 4-log kill, which is far more than needed for COVID, because this is the gold standard, basically. So that also means that incineration is really not needed for COVID. Incineration is operating at 8,000 degrees, 1,050 degrees, 1,200 degrees, depending on what type of incinerator you're using. And yet COVID is destroyed in 70 degrees, even before boiling, in a matter of a few minutes. So it's overkill. And so to the extent that we can use these more environmentally sound technologies, we should. And I mention this because if you start incinerating everything or burning everything with COVID, and that's what many a number of countries were doing when they started panicking, you can actually make the situation worse. I'll mention two ways it makes it worse. One way is because by burning, you produce a lot of toxic emissions, including dioxins and furans, which are among the most toxic substances we know in science. And one of the concerns I have today is that in India and many countries, we test these incinerators or pyrolysis or gasification units only once a year or maybe twice a year. And yet there's a lot of data to show that that is not enough, that actually throughout the year, there are times when the dioxins are quite high and we do not capture it by just testing it once a year. But the other reason, especially for today, is because of this study that came out. It was done by Harvard University, came out a few months ago, where they found out that by exposing people to particulate matter, especially fine particulate matter, which we call PM 2.5, you actually increase the rate of death for people who are suffering from COVID-19. In fact, at the bottom it says an increase of 1 microgram per cubic meter of PM25 is associated with an 8% increase in the death rate for COVID-19. And notice what the particulate matter limit is under the Biomedical Waste Management rules. It's 50,000 micrograms per normal cubic meter. So a lot higher than this 1 microgram that they said was enough to increase the rates from COVID deaths. So that's a concern I have. So to the extent that we can use autoclaves and microwaves and all these other technologies that are more than adequate to kill the COVID virus, we should. Here are a few best practices that I've compiled from talking to people around the world. One is we have to do what we already know we should be doing, and that is segregation. Segregation, segregation, segregation. We need to separate the infectious waste from the general waste. That way we don't contaminate the general waste, which could be taken care of in the regular ways. The second thing that's important is regular cleaning and disinfection. Because we know that the virus can stay for, depending on where it's at, could be from hours to a day or a few days. We need to do in the hospitals and in quarantine centers and facilities, we need to disinfect on a regular basis the common things that people touch, which include things like door handles and window knobs and so on. And we need to, and in the schools, by the way, computer terminals that might be shared and things like that. And, but for people working with waste, we need to frequently disinfect the waste containers, the trolleys, as was mentioned by Ms. Puri. Another important thing is PPE. So I list the PPE that are required. We need to protect our waste workers. They need to have masks and shields, heavy-duty gloves, and so on. And here's an important thing that I also mentioned. We need to train our waste workers, and actually all workers for that matter, in hand hygiene, frequent hand hygiene, especially when they remove their PPE. When I was working in Africa on Ebola, one of the ways many doctors and nurses end up dying is because they would remove their PPE, like their masks and so on, but they would not do hand hygiene, and they wouldn't realize that by removing their PPE, they had contaminated their hands from whatever virus was in the PPE. So after the removal of PPE, there needs to be hand hygiene immediately. And as I mentioned, we need to focus on environmentally sound treatment methods. Another thing is environmental cleaning. So blood spills, WHO suggests 1% bleach. General surface cleaning, 0.5 to 0.1% bleach is adequate. For non-critical items, you can even go as low as 0.05 bleach. If you're going to soak them for about 10 minutes, that's more than enough. If you're in a hospital and you have contaminated linen, the WHO says you can soak it in 0.05% bleach for 30 minutes. And then I would add, then you should just wash it the way you would regular linen with soap and warm water, And as I said, that's an added precaution, an added safety factor, because soap will destroy any, although the virus will be destroyed at 0.05% bleach in 30 minutes, but just in case there's even any remnants, soap and water will take care of it. I added some caveats which you could read at your leisure. It's basically saying that we also need to know that bleach can degrade quickly, so you need to change your bleach solutions on a regular basis, but you also shouldn't just dump bleach because it has an impact to the environment. So you can either leave it out in the sun to decompose naturally, or you can add hot water or use some of the neutralizers. And then some points about PPE. Today around the world, we're hearing reports from my colleagues in Europe, from people in Hong Kong, here in the Philippines and many places, where we are finding so many masks, so many gloves that are now all over the place on land, and even in the ocean. They're being found in seabed. That picture at the top right is from a diver that found all of those masks at the bottom of the sea. And they found this also in Hong Kong and other places. And so one of the things we should do is to, as much as possible, if we can afford it, to try to use reusable PPE instead of disposable. There are, for example, elastomeric respirators have the same level of protection as an N95 or an N99 or an FFP2 or FFP3, and in some cases even higher. However, this requires a bit of an investment. And if you do this, then you can keep using it for years, of course, but you need to make sure you have guidelines in the hospital and training on the proper way to disinfect them. And those are well known and well established. Now, I've always been asked, can we disinfect the N95 face masks that's needed? By the way, when I say N95, I really mean the high efficiency masks that we really need in hospitals. So it's not just N95, N99, FFP3, FFP2, P2, P3, depending on different countries have different ways, but they're basically equivalent. The N95s are equivalent to FFP2, they are equivalent to K95, equivalent to P2, and so on. Now, these are recommended, highly recommended that you use this when you're doing any aerosol generating procedures like intubations, bronchoscopy, ventilation, and so on. Those are high aerosol generating procedures. A lot of virus could be released as aerosols. You need to be protected from that. You cannot take an N95 or an FFP mask and simply sterilize it with bleach or soap and water, or even autoclave it and then use it again. Unfortunately, you cannot do that. And I mentioned two reasons. One is because these high efficiency masks have an electric charge, a long-lasting electric charge put on them when they're manufactured. The moment you wash them in soap and water and put it in an autoclave, that electric charge is removed, and so they're no longer able to capture the particles of virus that's supposed to capture. They can still capture some of the virus, but not at the efficiency that they were made for. And by using, say, bleach or autoclaving, you can begin to degrade the polymer fibers that they're made of. There are some treatment methods that can actually be used so that they can be used again, but these are more expensive, but they only allow you to do this on a certain number of times, maybe 3 times or 12 times and so on. So what are other possible solutions to deal with this problem of so much PPE? So I will make some suggestions. There are many types of PPE that can be reused because of the very nature. For example, face shields, nitrile gloves, reusable gowns, and cloth masks. So here I just give you a quick example of a sample procedure that could be used based on science. And if you want, you can test this. If you have a microbiology lab in your hospital, you can test the procedure. And so basically, I would recommend that you soak these PPE, or especially the cloth mask and so on, in soap and hot water. Remember, this can, if you have soapy water for 10 minutes, you can no longer find a virus, but soak it for 30 minutes to be sure. Rinse it well. And then as an added precaution, you can soak it in 1% bleach for another 30 minutes. and then rinse it well to remove the bleach, and it's good. It should be good to go. Now, I found another study, which is interesting because I did a similar study for Ebola, and we did this in West Africa, and that is after we disinfected the PPE, we left it out in the sun to dry. And it turns out there was a study that was done, I think 1 or 2 months ago, that was published. You can see the reference. What they do is they calculated how long would it take to keep the virus, and this is without disinfection, keep the material that has high levels of virus so that the infectivity would be reduced by, say, 99% or more under the noonday sun. And they did the computation for many cities around the world, including one in India, which was Mumbai. And what they computed is that if you leave it under the sun, noonday sun, for 2 hours, especially if it's not raining and not cloudy, it would then basically reduce the infectivity. So that's an added safety factor. And so that's something that you might consider as well if you want to be able to reuse your PPE. So I hope this information has been useful, and I thank you very much for your attention.